Each year, 50,000 people get sick with tuberculosis, and 10 of them have multi-drug-resistant TB. The multi-drug-resistant strain is that type that will not respond to the first-line TB treatment, and if this is passed on, the new patient will also have the resistant strain.
Once patients begin this treatment, in the first 2 months, they are very ill. In the other 6 months, they are okay, they have gone back to work. Majority of them continue to take treatment, but they may look at coming to the facility for sputum follow-up as a waste of time.
And while a patient on the first line takes 70,000 for treatment, 8 million shillings is spent on a patient who is resistant to the first line. Treatment takes 24 months compared to the 8 months that a patient with a simple TB strain to complete their treatment.
MDR-TB has a very high cost on the productivity of the patient, the family, and the government in the form of lost productivity, times, hours, months, and even years.
For 4 years since 2008, 300 patients with multi-drug-resistant TB could not access treatment because Uganda had high levels of defaulting plus the high cost of treatment. But in 2012, the government, with the Global Fund money and USAID under the TB Care 1, managed to produce drugs for the multi-drug-resistant TB, and the situation is better.
The TB treatment outcome was very poor. Like treatment success was less than 20%. So that means more than 80% of the patients would have either default or lost follow-up, and the outcome was not known for many patients. And yet Kampala has very high TB burden. So over years, since then, treatment success has improved to more than 70%.
These efforts are being backed up by case follow-up and proper record management.
We're doing wrong, and the policy comes and it has to change.
The World Health Organization declared tuberculosis a global health emergency over 20 years ago. TB is a highly bacterial infection that affects the lungs.
We live in poorly ventilated houses, and when there's someone who has TB in such a place, then other people who are living with that person can easily catch TB.
Those considered at a high risk of getting TB include those who live with others who have active TB infections, diabetics, cancer patients, and those with HIV or other immune system problems, the poor, older persons, alcoholics and intravenous drug users, and those who suffer from malnutrition. Signs of the disease include persistent coughing for over 3 weeks, fever, loss of weight and appetite, as well as night sweating. Irene Namialo, NTV.